Hello, my name is Anamaria Cozma-Petruț. Welcome to the second episode of the FIP CPD Bites series on self-care approaches for fatty liver disease management. This episode will provide an overview on how pharmacists can support a holistic approach to the care of patients living with fatty liver disease. Evidence shows that community pharmacists are among the most frequently visited healthcare professionals. Therefore, pharmacists can play a crucial role in the early detection and management of metabolic dysfunction associated steatotic liver disease or MASLD. For instance, pharmacists can help identify individuals at high risk of MASLD by screening for the risk factors of the disease. A visual assessment of the patient, a casual discussion about the general health, or even a brief overview of prescription medication or blood test results might reveal these risk factors for pharmacists. For example, patients who are overweight, who have high blood glucose, high blood pressure, abnormal blood levels of triglycerides or HDL cholesterol, and patients who take medications for type 2 diabetes, hypertension, or dyslipidemia are at increased risk of MASLD. Furthermore, patients with MASLD commonly present with elevated liver enzymes, so pharmacists should consider assessing liver enzyme levels. Additionally, pharmacists should look out for symptoms such as fatigue or right upper abdominal discomfort, which, although nonspecific, could be suggestive of MASLD. Identifying patients at high risk for MASLD or potentially having the disease allows pharmacists to take further action, meaning that pharmacists can refer the patient to the primary care physician, and they can also establish in the pharmacy early interventions to control MASLD development or progression. Such interventions include providing lifestyle advice as well as recommending hepatoprotective treatment. Lifestyle modification and weight loss are the cornerstone of MASLD treatment. Therefore, pharmacists can educate MASLD patients about the importance of adopting a healthy diet, such as the Mediterranean diet, accompanied by calorie restriction to achieve weight loss. Adopting a Mediterranean diet involves ensuring a high intake of plant-based foods, fish and olive oil, while minimizing the intake of foods rich in saturated fat and refined sugars. Furthermore, pharmacists can encourage MASLD patients to engage in regular physical activity, including both aerobic and resistance training, at a level adapted to their baseline fitness. Additionally, pharmacists can counsel MASLD patients on smoking cessation and alcohol abstinence. It is important to emphasize that weight loss is beneficial for all patients with MASLD. In MASLD patients who are overweight or obese, a weight loss of 3 to 5% is usually necessary to reduce liver fat, 7 to 10% to improve liver inflammation, and more than 10% to improve fibrosis. The positive effects of moderate weight loss also extend to lean MASLD patients, in whose case a 3% weight loss is likely to result in MASLD remission. Weight loss has a positive impact not only on liver health, but also on cardiovascular disease risk factors, such as hypertension, high blood glucose, and dyslipidemia. Several national practice guidelines on the treatment of MASLD suggest that patients with fatty liver disease should use hepatoprotective agents as supportive treatment. In agreement with these guidelines, pharmacists can recommend to MASLD patients hepatoprotective agents that have proven efficacy in clinical studies, and this might include essential phospholipids, vitamin E, and silymarin. A recent scientific publication summarized the available data concerning the efficacy and safety of different hepatoprotective agents in treating mast cell. And the publication concluded that there is a large body of evidence indicating that essential phospholipids, also called EPLs, are a promising treatment for patients with mast cell and are generally well tolerated. EPLs represent a highly purified extract of the semen of soybeans with standardized contents of 72 to 96% 3-SN-phosphatidylcholine. Preclinical studies showed that EPLs may improve liver function by increasing hepatocyte membrane fluidity and also by exhibiting antioxidant, anti-inflammatory, anti-fibrogenic, and anti-apoptotic effects. Likewise, a recent meta-analysis of clinical trials demonstrated that the administration of EPLs provides benefits in patients with mast cell and type 2 diabetes and/or obesity, being associated with significant symptom improvement, reductions in alanine aminotransferase, triglyceride and cholesterol levels, and improvement of the disease severity assessed by ultrasonography. In most studies in humans, EPLs with 76% of 3-SN-phosphatidylcholine were administered. Some key takeaways are that pharmacists can play a crucial role in the early detection and management of mast cell, helping to prevent the progression of this disease. Pharmacists can educate patients with mast cell about the importance of lifestyle changes and weight loss, which represent the cornerstone for the management of mast cell. Moreover, pharmacists can recommend hepatoprotective agents with clinically proven efficacy, including essential phospholipids, as a supportive treatment for patients with mast cell. And the next CPD Bite episode will explore this topic further.